Is a good thing, and I want to hear from people and hear their views so that I can take those views back to Washington with me as we're trying to find the best path forward for how we do healthcare reform.
Your party has majorities in Congress. Does the president bear responsibility for not having a more effective strategy to move this issue forward?
Well, the issue of healthcare reform is certainly not an easy one. This is healthcare reform, and the healthcare crisis that we're in is a complicated issue. If it were an easy issue to solve, it would have been done long before now. I think that the administration has been doing a good job about trying to get its message out about what we're trying to accomplish, that this isn't a big government takeover of health insurance. It's about setting up really a system of private competition within the health insurance exchange, and we need to get that message out to people. Certainly there's one of the proposals, at least on the House side, is to have a public option within the health insurance exchange, basically another option for people to choose from. But really this is all about healthy competition within the market.
Congressman, there are a lot of people outside, a lot of them, who are pretty angry. Do you expect, you say you're going to listen to them, but do you expect that they'll change your mind about universal health care?
Well, no one's going to change my mind about the fact that we need to fix our healthcare system. The healthcare system is in crisis. The path that we're on right now is unsustainable, and doing nothing isn't an option. The country will be far worse off in the years to come if we don't tackle the issue of healthcare reform right now. I understand that people are concerned because of a lot of misinformation that is out there. And of course, anytime you try to change something, that in and of itself is going to evoke concern and passionate responses from people. But it doesn't mean that we shouldn't take on the challenge of trying to fix healthcare. And that's what really this is all about. Now, I also understand that part of the anger and the frustration that people are feeling right now is the fact that we're in a bad economy. We have a 12.4% unemployment rate. People that are out of work are wondering where the jobs are, and we're working hard to try to create those jobs. But with the economy in tough shape, with the high unemployment rate, there's a variety of reasons why people are concerned and angry right now. I'm angry, quite frankly, that we're in the situation that we are, that the economy almost went off a cliff, that the banking system almost went off a cliff, and the government had to step in and try to shore up the economy through the stimulus program and put money into the banking system. These are not votes that I wanted to take. These are not things that I wanted to be voting on and undertaking, but quite frankly, there was no other way to do it. There were not a lot of good options out there. The steps that we took were necessary steps to fix the economy. So we're trying to create jobs, trying to get the economy back on track, and quite frankly, fixing our healthcare system is a vital but an important part of getting our economy back on track.
What do you say to the people that think this is playing Big Brother here, that the government wants to control everything? What do you say to that?
We don't want to control everything. But again, the path that we're on right now is just unsustainable. In addition to the fact that we have over 47 million Americans without health insurance, the government is already spending far too much on health care right now, and we're just spending it in the most inefficient way possible. We want to make sure that we're spending those dollars more efficiently, more wisely. Right now, the government spends itself over $40 billion a year on uncompensated care. So it's not that there's no cost with covering the uninsured. We just do it, again, in the most inefficient way possible. There are other costs involved with our health insurance program that is being spent inefficiently. We spend it really, we have a system in which we treat sickness but don't promote wellness. That's what we're trying to change right now with overall health care reform. Not only covering the uninsured more effectively, but making sure that we're spending our healthcare dollars more wisely and promoting preventative care as opposed to just treating sickness.
Will you support a bill without a public option, Congressman?
Right now, I know that the bill that's moving its way through the House right now does have a public option. I expect that is the bill that we will be voting on in the House, a bill that will have a public option in addition to a variety of other choices of health care plans for people to choose from. At the end of the day, I don't know what's going to make it through the Senate and through conference, but it is my hope and my expectation that we will be voting on a bill that does include a public option.
Congressman, you've said that one of your bottom lines is that you don't want any federal funds spent on abortion. one of the difficulties is that some of the plans in the exchange will likely be subsidized. Does that, to you, count as federal money if those plans were to cover reproductive health services? Does that, to you, count as spending federal dollars on abortion, and would that be enough for you to vote against it?
I don't want to see any single issue derail healthcare reform. And when the abortion issue started coming up, I, with a group of like-minded, moderate, pro-life Democrats, got together and sent a letter to the Speaker of the House saying that we should make sure that we preserve the status quo, that no federal funds are used to provide for abortions, and there is in fact language at this point in the bill that came out of the version that came out of the Energy and Commerce Committee. It says specifically that federal funds can't be used for abortions, as is current law, with the exceptions of rape, incest, or to save the life of the mother, which is the current status quo under federal law.
Are premium payments to a public plan federal funds?
It's very clear in the language that we've asked for that federal funds can't be used for to cover abortions, whether it's in the private plans or any public plans. That if there were any money that were used, it would have to be private dollars.
But that would mean then that any premium payment to a plan that covered reproductive health services would count. Yes. If
they were private dollars, we're not in the exchange. It's the issue is silent as to whether abortion coverage is allowed. That would be up to the private plans themselves. Some plans offer it, some plans don't right now under the current way that healthcare plans are offered. What is clear is that federal dollars can't be used to cover abortions.
Congressman, as you alluded to, this is a complex, multifaceted problem that could potentially a big change in the American healthcare system. Does it have to be put through in a single 1,000-page bill, or couldn't the problem be broken up into more manageable chunks that people would have time to digest and think about?
Well, we're trying to look at this holistically, the issue of healthcare reform in general. That, as I said, the current path that we're on right now is unsustainable. That the healthcare system is in danger of running off a cliff. And we don't want to see that happen. The time to act is now. So we're looking at a system that is really right now dominated and controlled by the insurance companies. In many ways, health insurance decisions are made by insurance companies. They're denying coverage every day. Employers who are struggling to provide health insurance to their employees are really at the mercy of the insurance companies when they're negotiating healthcare plans, and they each year they I'm sure dread getting the letter from their health insurance provider as to how big the increase is going to be. Is it going to be 20-30% increase every year? What we're trying to do right now is change that type of a system, creating this health insurance exchange that promotes more competition and transparency in the health insurance market, so we put the people in control and give companies and their employees much more say over healthcare, how it's the plans are negotiated, and not the insurance companies. So it's changing the dynamic really of the health insurance companies really dictating to employers and employees how much coverage is going to cost or what's going to be covered, and now we're going to put this health insurance exchange in place, so we give consumers much greater control over how plans are negotiated.
Congressman?